Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today we're going to be talking about PluroGel burn and wound dressing. But first, if you could hit that like and subscribe, it would be greatly appreciated as it truly does help my channel grow. So let's get started. So PluroGel is a translucent, biocompactable, water-soluble burn and wound gel dressing. So it does provide autolytic debridement, so it does soften and loosen necrotic tissue and debris for removal. It does disrupt and inhibit biofilms from growing. It maintains a moisture balance for the wound, so it does add moisture to the wound, giving optimal healing if you have a dry wound. It is non-cytotoxic and contains a gentle water-soluble surfactant. And it is compatible with all wound cleanser, all secondary dressings, including antimicrobials. So indications for use. So we're going to use this on wounds that have a light to moderate amount of drainage because it does add moisture to the wound. And also we want these wounds to need some sort of debridement. So this provides an autolytic debridement or management of a biofilm if there's a suspected biofilm. Precautions, so we're going to discontinue use if there's any irritation. Another precaution is that you want to just keep it at room temperature and make sure that you keep the cap on very tight, and it's only good for 28 days. Okay, so you do have to throw that away after the 28 days if it has not been used. So make sure you're labeling that. Now, contraindications: if the patient has any allergies to any of the ingredients in the product, please do not use it on the client. So first, just like any other wound, we want to make sure that we are first cleansing and irrigating the wound with either sterile normal saline or sterile water. And then we're just going to dry the peri-wound tissue. And you can use a barrier film if the cover dressing allows for that. Some cover dressings you shouldn't be using a barrier film with, so just make sure you know your cover dressing, what you're putting on top of the wound, if you can use a barrier film. Just another thought here, because this adds moisture, if you're noticing that there's too much moisture in the wound after a couple of days when you go to change the dressing, sometimes if you're getting too much moisture, the product does need to be stopped also. So actually applying the PluroGel. So we want to make sure that the first time we're opening this, we're writing the date on the tube because it's only good for 28 days, and also the patient's name. Now, when we're applying the PluroGel, there is different thicknesses that we can apply it. So for lightly draining wounds, we can just put it 3 millimeters thick. For the more moderate wounds, draining wounds, we put it 5 millimeters thick. And if you're not changing the dressing daily for any wound, you put 5 millimeters thick automatically. Okay, so if it's not being changed daily, make sure it's at 5 millimeters thick. So for shallow wounds, just ensure that you're keeping the actual PluroGel tip sterile, okay, because we're going to be reusing this, so you want to make sure that you keep that sterile. So if you're putting it in, just make sure that you have a cotton tip applicator or a tongue depressor just to kind of help you, so you're not actually like wiping it off on the wound at all. You don't want the wound to come in contact with the actual tube. And then you're just going to apply your sterile cover dressing. And the PluroGel will not harm the peri-wound if it does come in contact with it. Now for your more deeper wounds with undermining sinuses, tunnels, we want to, once again, make sure that the tip of the tube is not touching any part of the wound, so have your cotton tip applicator ready, and you can apply this to your gauze, okay? So any wound filler, you can just moisten it a little bit, dampen it with sterile saline, and then put this on it, and then just have sterile gloves. get it all on there, and then make sure it's coming in contact, and you're just lightly fluffing it into the wound base. We never want to put too much pressure into a wound. It's just lightly fluffed, not stuffed. Okay, lightly fluff. And then just make sure that you are leaving a tail so it can easily be removed. Now, if you are putting in more than one piece, make sure that you're documenting this. I always try to put only one piece in. Make sure you're pulling it long enough for the wound filler, and only one piece into the wound. I have found if I have an extremely large, I'll tie them together, kind of knot it, and that works great. So to remove the dressing and the packing, we're just going to, if there is packing, you can just pull it out. If it's stuck, you're going to cleanse or irrigate it, and it will just come out. You might have to give a little bit pull, but just let it saturate a little bit. If any dressing's ever stuck, just let it get saturated a little bit and it will release. So just clean it with your normal saline, your sterile water, or any other wound cleanser that's agency approved. And then you're just going to take either saline moistened gauze or whatever you're using to clean the peri-wound tissue. The expected outcome of this is that you have a clean wound bed with nice granulation tissue within a few weeks. Now, for the frequency change of this dressing, for optimal results, you want to change it daily, especially for the first 2 weeks. After that, you can go to every 2 to 3 days. Just make sure that it is the 5 millimeters thick that you're putting that gel. So that's all I have for this video. If you haven't done so already, if you could, please hit that subscribe button. It would be greatly appreciated, and I will catch you guys in my next video. See ya.